Good morning, I'm Erica Manalo and we're going to perform a breast examination. So first is breast examination. Let us explain what we're gonna do to our patient. So good morning ma'am, I'm Erica Manalo and I'm going to palpate for your breast to clinically examine if there are any abnormal masses or observe if there are any scars or lesions or any swelling. Is it okay po for me to palpate it? So also you ask permission. And then after that, you also make sure that all the results of these examinations will be confidential to both of you, or to only both of you will know the results. And then after that, you also ask if it is her menses, because it should not perform clinical breast examination, and self-breast examination should not be done during menstruation because the breast will be tender. Okay, so you also ask the patient to perform self-breast examination on her home. So let's start. So let the patient drape and remove her bra and then change for a lab gown. So first is for the inspection. So let the patient sit in a relaxed position, her hands on her thighs. So let her remove the lab gown. So for example, this is our patient. So yan. So let us first inspect for the breast. So on the breast, we inspect for the asymmetry of the breast. So usually left is larger and also sometimes lower. And then we assess for any visible masses, lesions, scars, or any skin changes, if there is any erythema on the nipple, if there's any discharge or retraction. Also check if there's puckering or dimpling of the breasts. Also if there are any masses, lesions, scars, striae. So that's all for inspection. So after that, let the patient place her hands on her waist. So that is for to tense the pectoralis major. So if you tense the pectoralis major, if there's any mass that will also tense or also move alongside the tensing of the pectoralis major, meaning that is what called tethering, meaning there's a malignancy, possible malignancy. So after that, and then let the patient also place her hand on the back of her head. Also again check for and also inspect again for any visible masses, lesions, scars, striae, any lump, anything that is abnormal. Then after that, so you both check up. Then after that, you can do your palpation of if there's any enlarged lymph nodes. So you ask the hand of the patient, sample on her, this is her right. So let your arm support her right arm, and then now you palpate for the axilla, for the anterior, posterior, medial, and lateral walls of the axilla. So palpate, and then also on the other side, grab her head or support her arm with your arm, and then let your other hand palpate for any enlarged lymph nodes. And then also you can do a cervical lymph nodes palpate, also the supraclavicular, infraclavicular, and your parasternal lymph nodes. Okay. So after that, let your patient lie on a supine position with a 45 degrees angle on her neck. So example, this is our patient now. So this is the breast of the patient. So also ask if there's any abnormal, if she can feel any abnormal, and let that be last for palpation. So let us first go with the left breast of the patient. So cover first the right if you will not examine it already. So first for the palpation, there are 3 depths of palpation. Also first warm your hands and start. There are different types of method in palpation, but for me I'll be going on the center outwards, and then palpate, check downward pressure in a circular motion. So all quadrants should be palpated. So there are three types of depth of palpation, which is the superficial, the medial, and the deep palpation. But gentle, do it gently. So if there's any mass, you should report it. First is the location, if it's on the 3 o'clock position, and then estimate the size if it's 2 to 3 centimeters. Determine the consistency if it's thick, if it's rubbery or solid, and then also ask if it is tender or non-tender, and then check if it's movable or not movable. So usually in malignancies, the lump or the mass is non-tender, it is non-movable, and hard in consistency. So also ask the patient, ma'am, can I just squeeze your nipple to check if there's any discharge? So first is to ask permission, and then squeeze the nipple, check if there's any discharge. So if there's discharge, you should report it as if there's a foul smelling or no odor, or the consistency if it's thick or watery, and also the color if it's color yellow or white. Also check if there's still skin changes alongside with the vaginal or the nipple discharge, I'm sorry. So and then after that we cover, and then we also do the same thing on the other side. So again, we palpate it in a circular motion, assess it, and then nipple, squeeze it, ask permission. Then after that, you explain the findings to your patient, and then ask the patient if she has any questions, and thank the patient, and then let the patient drape or let the patient change her clothes. That's all. Thank you so much.